Hi, I'm Dr. Saish Prabhu, and today we are going to talk about knee osteoarthritis. So, first of all, what is knee osteoarthritis? Knee osteoarthritis is when a cartilage between the knee joint, between tibia and femur, these two bones, starts to get wear and tear. So, the knee joint is quite complex. It has many aspects of it. You have the cartilage, that is, we just talked about. Then you have multiple tendons. Then you have meniscus. Then ligaments. Everything that packs into a small joint. So it looks very simple, but it's very complex. So knee osteoarthritis is basically when this cartilage, it is getting wear and tear. So it happens because we use our knee regularly. So it starts getting a lot of friction and slowly it starts becoming thinner and thinner. So it happens after a certain age, like around 30 years later, 40 years later, it starts slowly degenerating. So why does it happen? First of all, the body is capable of repairing itself. Any part of the body, whether it's bone, whether it's skin, whether it is your tendon, it is able to repair itself. That is the God gift for us. Now, the cartilage, as the age progresses, at the beginning it is able to repair itself. It is able to retrieve that calcium and protein from your nutrient and able to deposit in that cartilage and repair. But as the age progresses, what happens is because our mind gets too much distracted, we are not able to naturally focus on it. We are not able to rest enough. We are not able to retrieve the nutrition properly. So that repair work is kind of stagnant. And many of the time, the cause is due to various reasons like chemical, wrong intake of food, or eating a lot of garbage food, to be honest. So slowly, your kidney, according to acupuncture science, the kidney is responsible for repair of this cartilage. But the kidney is not able to give that enough energy to that joint. So the kidney is busy trying to uphold the natural and the most basic functions of the body like metabolism, water balance. It is too busy throwing away all the toxins that we consume every day. And especially in women when after certain age, so they are getting pregnant, and after the pregnancy, the delivery, the kidney energy is depleted to a very large extent. So the repair work of the knee is kind of put aside. So as the age progresses, after 30, 40 years, the body is not able to repair the cartilage like how it used to do when you were young. So what are we supposed to do when the cartilage gets worn out? First of all, we have to reduce the usage of the knee joint. So walk as less as possible. Now, most of you will think that most of the doctors today are recommending that you should walk more. So the ideology behind walking more is that your muscle will become stronger and the load on the knee will become less. Yes, that is true if your cartilage is not wearing out. So once the cartilage start wearing out, it is as if like your tires are worn and I'm trying to tell you that you have to drive more. So that will be the most stupid thing that you can do, because if you use the car joint more, it is going to get more and more wear and tear. So which is not good for body. So first of all, less usage of the joint will help to a certain extent, but it will have its limitation. Second thing, how do you actually recognize that you actually have a knee pain due to knee osteoarthritis? One of the classic things that will let you know that you have a knee osteoarthritis is you start getting pain only while you're walking, you're climbing down the stairs, or sometime climbing up the stairs. You'll find really heaviness in your joint. So these are the main basic symptoms that will tell you that you have a probable the wear and tear of a cartilage in your joint. So first of all, as I said, you have to reduce regular walking. Second thing that most people have a misunderstanding is that if you take calcium intake, that is calcium supplements, then it will help you reduce the wear and tear or even help it repair. But it doesn't work in that way. The body doesn't follow these principles of if you take calcium, it will deposit the calcium in the joint. Because the body doesn't recognize artificial calcium as a natural source of calcium. So when you take an artificial calcium, it is as if you're taking only one thing. It is not coming in a bundle. So I'll give an example. Like we take water. So the body requires water for its basic metabolism. So when you intake water, what it requires is an H2O molecule. But when we take mineral water or any resource, it is never having an individual water molecule. They have plenty of other things. It has minerals, it has sodium, it has magnesium. All the nutrients are present together in that water. That's what makes it acceptable by the body, and that all those nutrients together will help the water molecule to go into the cell and help in continuing the metabolic processes. Now, if we think that only the water molecule is the essential component, then we will retrieve only the water molecule through distillation and we consume it, right? But it doesn't follow that. If we take that distilled water, it is going to be very harmful for the body. So, similarly, if you only take calcium intake, and we think that okay, calcium is the basic supplement that requires to develop the joint, then this calcium will not be recognized by the body and it will be actually thrown by the body out through kidney. And if the kidney is not able to properly metabolize it, then it will be stored in the kidney as calcium oxalate stores, and then we call it kidney stones. So this will complicate things further. So instead, always try to take calcium through natural sources. What are the natural sources? We have a lot of grams, chana, all this naturally occurring calcium can help you regain that calcium, and this nutrient will be able to deposit it naturally. Apart from this, the most easiest way to repair the joint is through natural treatments like acupuncture, for example. So acupuncture, what it does, it goes deep inside the repair system of the body. It helps to replenish the kidney's energy. Once the kidney energy is restored, it is able to recognize that this knee joint requires an utmost attention, and then the brain is increasing the blood circulation energy flow to the knee joint, and slowly the muscles are strengthened and the cartilage is repaired. So this is how we actually with acupuncture can restore your natural repair system of the joint. Remember, we are not just repairing the joint, we are restoring the natural repair system of the body, which will keep on repairing itself till your age progresses. So it is going to be as if your knee is going back to its early 20s. So this is very important to know why acupuncture has a long lasting or almost a permanent solution, is because we are not just repairing the joint temporarily. We are not eliminating the pain symptoms. We are not eliminating just the swelling. We are not just addressing the swelling, but we are treating the root cause, restoring the balance, restoring the repair system, and that is how it is going to repair. As I talked about the symptoms, let me also clarify some of the things that most people have a misunderstanding. When we see pain or swelling, we try to address it as fast as possible by taking painkillers, removing this swelling with injections like that. But when we remove those symptoms, the brain is not able to recognize if the joint is actually repaired or not. So we think that, okay, we don't have the pain, we don't have the swelling, so we are going to use the joint as normal. But the joint is not repaired. We are just not realizing, the brain is not able to recognize if there is the problem or not, if the problem is there or not. So it is very important that we don't eliminate the symptoms first. We repair, and as the repair progresses, the symptoms are taken away, and slowly, these symptoms will reduce. If you remove the swelling and you try to think that okay, the joint is repaired, so you just walk normally, then what happens? The brain thinks, yesterday it was swelling, today it is not swelling, but I'm feeling that there is still pain there. So it will try to send more fluid to that area to smoothen the joint. Remember, the brain is very smart. It is going to send those enough fluid to keep that joint from having friction because the cartilage is worn out. So to avoid that friction, it is going to send fluid in the synovial joint, so that will kind of increase that area in the space. And if we remove the fluid, the brain will think, I have sent some fluid which is not working anymore. So I have to send more fluid, so next time it will going to grow more swelling there. Same way, if you remove the pain with painkillers, what is going to happen is you are going to think that okay, I don't have pain, so I'm going to use the joint normally, I'm going to walk normal, I'm going to do all my activities, which in other case, if you have pain, you will be more careful, you will avoid these things. But since you don't have pain, you are going to use it normally, and when you do a normal work, then the joint is going to get more and more damaged, it is going to degenerate more, and once the painkiller effect is reduced, you are going to suffer from more severe condition. So it is always advisable not to take painkillers, not to take any chemical supplements like calcium, and not to take medicines which will reduce the swelling. So try to heal it the most natural way. Another misunderstanding that most people have with respect to knee osteoarthritis is that your increase in weight or obesity or increase in body fat is what causing the knee joint to cause that problem. It is because of that pressure on the knee that is causing your knee to wear and tear. But to be honest, it is not actually the weight of your body that is going to damage the knee joint. Of course, your weight is going to make you feel more tired, more pain, and increase the wear and tear. But weight is not the cause, because you can see from our videos, the patients that we have treated, we have not touched their weight at all. But we have treated their knee osteoarthritis, and with the same weight, they are able to do all their activities normally. So weight is not the cause. So don't go on decreasing the weight with workouts, with by increasing your walk and everything. It is going to only damage your joint. So the best way is to treat your knee osteoarthritis with the natural way of restoring the repair system, rather than actually doing all those things which might damage the knee. Apart from this, one of the common thing after the knee joint is worn out to a certain extent, that doctors suggest you a knee surgery. So the knee surgery is basically they are putting a plastic or other superior material joint by replacing the original joint. So when you put an artificial joint, it is going to be useful only to a certain extent, provided your surgery is successful. So if your surgery is not successful, that's a very different issue. You can have a lot of other troubles. But if suppose we consider that your surgery is successful, then that joint is going to last as long as you are not using it much. If you use your joint regularly, you walk, you do your regular activity, that is what you're doing, you're trying to achieve, restoring your quality of life, then in 3 to 4 years or 5 years maximum, the joint is going to get worn out again. After that, the body is not able to recognize it as a natural joint. So even with acupuncture, even with natural healing therapy, we are not able to restore that repair capacity. So slowly you will have to replace the joint again. So again, your body has to be able to undergo that same process of surgery to repair that joint or replace that joint, without which your pain will be unbearable even in a normal condition, even if you are not working. So my advice, if you can find like us who can treat your knee osteoarthritis with natural acupuncture therapy and repair it naturally, rather than going for a surgery, which is kind of a very tedious and very risky job, and avoid supplement as much as possible to avoid future complications. I'm trying to share as much as information possible through our channel. So like it, subscribe, and try to share it to maximum people who might need this information. And do subscribe our channels. Apart from this, we are going to share a lot of information which will flood your brain with a lot of information and make you wiser every day.